The opinions expressed are those of the program host and guest and are not those of WSTU. WSTU does not endorse products that may be mentioned. Any reproduction or retransmission of this broadcast is strictly prohibited without written consent of WSTU. The phone lines are open. Call in with your questions and comments at 220-9788. That's 220-WSTU. It's time for Stuart Laser Talk with your host, Dr. Tred J. Rissacher.
I'm 5'10" and 242 pounds.
I always say this is the biggest I'm ever going to be, and I said that like 20 pounds ago.
A third of Americans are obese, another third is overweight.
Obesity is the biggest threat to the health, welfare, and future of this country.
I've always been overweight.
I've got diabetes,
Sleep apnea,
Heart disease.
everything's hurting now.
It's a lot easier to lose weight than it is to keep weight off.
This is probably going to be the first generation of children who are going to have a shorter life expectancy than their parents.
18% of our children right now are obese.
It's not only health, it's about survival and well-being of the United States as a nation.
You don't crave broccoli, and our generation has grown up craving a Big Mac.
I want to think that there's something better for me.
Unless we're able to control this epidemic, we're going to have an abundance of chronic disease.
All of us have to be part of the solution to reduce obesity.
The weight of the nation is out of control, but we can fix that.
If we don't now take this as a really urgent national priority, we are all going to pay a really serious price.
Obesity will crush the United States in oblivion.
At the beginning of civilization, there were three evil men who had discovered the secret to health. These evil men wanted to ensure that when the people needed to know how to be healthy, that they would be able to profit from their newfound knowledge. So they devised a plan. The first man said, "I will hide the secret to health in the tallest mountain to ensure they won't find it." The second man said, "No, someday they will explore all the mountains and find our secret. I think it would be better to sink the secret to health at the bottom of the deepest ocean. Then we can be sure no one would ever be able to find it there." The third man, who was more devious than the others, said, "I know a place where they will never look for the secret of health. I will take a little piece of the secret and put it inside each and every person. Then our secret will be safe because they will never think of looking there." So that is what they did. The secret to health is within each one of you, but for some reason, you have been fooled to think it is outside of yourself. Something you have to buy, a plan you have to belong to, something you need to have explained to you for a fee. Something to keep you dependent on something outside of your own body's ability to heal itself. My name is Dr. Tred Rissacher, and it is my mission, and sometimes my burden for over 30 years, to teach and expose this lie. The truth be told that your body's ability to heal is far greater than anyone has allowed you to believe. This has never been more of a problem than today. My name is Dr. Tred Rissacher. I want to thank you for tuning into my show, Slim Body Laser Spa's Health and Wellness. I can be heard right here on WSTU 1450 every Tuesday from 9 to 10 o'clock. The phone lines will be open, 220-9788 if you have any questions, and I think you might after what I'm going to go over here today. I can also be reached for private consultation at my Stewart office, Dr. Tred's Slim Body Laser Spa, 2311 Southeast Ocean Boulevard, Stewart, Florida. My phone number is 772-223-5885. You can go online at www.slimbodylaserspa.com, or you can email me at slimbodylaserspa@gmail.com. So the secret to health is within each and every one of you. And it's amazing in the last, I don't know, 30 years, 40 years, I'm 59 years old. My father was a practicing chiropractor in New York for over 50 years. And it's interesting the way he came about learning about the secret to health. Okay. And it was something that was an accident. When my father was 12 years old, this is a true story, people. When my dad was 12 years old, he was climbing in a tree in Valley Stream, New York at one of the parks. If you're from New York, Long Island, he fell out of the tree and he basically landed on his head. He landed on his neck, kind of kinked his neck. Went home, talked to grandma, talked to my grandmother about it, and everything seemed fine. Well, a couple of weeks later, within a week or two, he started to develop neurological problems. He started to have spasms and tics and weird movements that he couldn't control. His head would bob and shake. And he was only 12 years old. And my grandmother brought him right over to the medical professionals who seemed to have all the knowledge. They seemed to have all the accolades that come with lots of schooling and all the secret books. And basically they examined him and they came up with a diagnosis, something called St. Vitus dance. Now, if you're over 60 years old, you've heard that term. If you're younger than 60, it's called Huntington's disease. And Huntington's disease is choreiform movements, movements that are almost like dance-like. And the person can't control them. And they come in waves. They come up and down. And that's why they called it St. Vitus dance. And they told my grandmother that it was chronic. It affects males more than females, men more than women. And by the time he was in his 20s, he would be on an iron lung because it affects your breathing. What a horrible diagnosis. And they said the only option she had was to sedate with medication when he would have these spasms and tics. What else do you do? I mean, they're the authority, right? They have the secret. They have the knowledge. And so she medicated my father when he would have these spasms, these bouts, and it was not getting any better. And he suffered for close to 2 years. He was 14, 15 years old. And after observing him at a park, one of the people that were at the in Long Island had come over to my grandmother and said, "What's wrong with your son? I noticed he has this movement." And my grandmother told him the story. And the woman, she looked at him and she said, "Have you ever tried a chiropractor?" And that was, this was in 1934. So that was a long time ago. And my grandmother was like, "A what?" "Well, I can't explain it to you, but it has something to do with nerves and maybe something happened from the fall." Well, it made sense to my grandmother. She took him to this, and there was a chiropractor that was practicing outside of Manhattan in New York State. And she took my dad to this chiropractor and they x-rayed his neck, which the MD never did when they went to the first examination. They x-rayed the neck. And what happened was the top vertebra called the atlas, which is where your skull, and then it sits on top of the first cervical vertebra. They called it Atlas because Atlas in Greek mythology held up the world. So your atlas was that main bone, and that bone had shifted compared to its normal relationship as a result of the fall. And what would happen was when my father would be tired or he would turn his neck in a certain position, the symptoms were much exaggerated. So it had something to do with movement of the neck. They laid him on his side, and this chiropractor made one specific chiropractic adjustment at the right time, for the right reason, at the right place. And he realigned my dad's neck. And you know what happened? He never had any problem ever since that time. He was 15 years old. Changed his life. I mean, he just would have got worse and worse. Now, I'm not saying that adjustment cured Huntington's disease. What I'm telling you was he was misdiagnosed by the medical professional at the time, who do not believe in the alignment creating health problems for the most part. It's changing. We're getting better. But, you know? So what happened to my dad was it was a very life-changing experience for him. Now, he didn't go again and again and again and again like so many people do with chiropractors, but because it was it was what was needed at the time. Well, my father went off into World War II, near the end of World War II. He was on an aircraft carrier, and he told everybody about this story. And because you need to know if you're, if nobody tells you, the medical professionals aren't going to tell you. Remember, they hold the secret. They're holding the secret. And he decided at the end of World War II, he was going to go off to become a chiropractor. They gave him the GI Bill, and he could either buy a house, which so many people did. I think there was a big area in Long Island and Wantagh where they have these houses that all these soldiers came back from World War II for these houses. Well, he took his money and he went and became a student at the chiropractic college called Palmer School of Chiropractic. And all he had was a high school degree. He graduated in 3 years from Palmer with an incredible understanding that your body's ability to heal is absolutely critically important, and that the body heals itself. One reason why it can't not heal is that alignment can be off. You can have injuries and concussion of forces can happen to somebody's spinal column, whether it be a car accident or a slap in the back, or, your uncle swinging you around by your hands and accidentally letting you go. I remember one of my patients put their kid up on the counter to fill out the check, and the kid squiddled and boop, off he went off the counter right on his head. And there's so many ways that you can hurt your spine. The birth process can be very traumatic and pull and tug, and that can cause alignment problems. And what happens is, because the nerve system, the brain and the spinal cord have to travel through the spinal column, through that bony column, those bones are movable. There's 24 movable bones. And in between each one of those bones are spinal nerves. There's 28 spinal nerves that exit between those bones, those movements of those bones. And when you have a concussion of force that comes into the spine, that bone will shift. Sometimes it hurts. Sometimes it doesn't. It's silent. You don't even know it happens. But what happens is the brain can no longer send messages to the body, or it does it in a perverted, distorted way. And then you start to develop what they call symptoms. It might be headaches. It could be a spasm and a tick like my dad had when he was 12 years old. He couldn't control the movement of his body. It might be leg pain, foot drop. It could be bowel troubles. It can be what you call, stomach pains. My God, everything is controlled by the brain through the nerve system. And if you go to the medical doctors first, who do not believe or will not examine the spine in the way a chiropractor does, then you're missing out on what a chiropractor can do. And what the medical doctors will do is they will prescribe medications and symptom treatments for that. Well, they'll rule out cancer. They'll make sure you don't have any infections or tumors or any space occupying lesions, with a whole bunch of diagnostic testing and MRIs and CAT scans. And they'll send you to all their specialists, the neuro, the stomach guy, the lung breathing guy, and never really look to the main line, the main source of information, which comes from your brain to your body through your spinal column. And once you take the medications, they work. They get rid of symptoms, but they don't really address the cause, being that spinal alignment problem. So we have a saying in chiropractic. It's chiropractic first, medicine second, and surgery last. Now, as I explain this to you, I'm sure there's some people that are they're clapping their hands saying, finally, someone telling the people the truth. And there's a whole bunch of you out there that are saying, I wouldn't go to a chiropractor if it was the last doctor on earth. Are you kidding me? A bone cracker? My doctor I've known people that have gone to chiropractors. Their pediatricians have discharged them from care because they took their kid to a chiropractor. That's, it's this system. And, chiropractors are one of the first people that kind of stood up and said, hey, maybe these vaccinations we're getting aren't very good for us, because we see the result. We see the injuries that happen on some people, not everybody, but a few. And, we started questioning the use of anti-inflammatories and pain pills when the problem should be relieved when it can happen with posture and exercise and stretching. Chiropractors were standing up for that, saying this doesn't seem right. And it's amazing that the principle that the body heals itself is something which is really, really important. So I'm telling you all of this. I'm a chiropractor, and I have a body sculpting rejuvenation center called the Slim Body Laser Spa. But you can't separate me from my core beliefs, the things that I grew up doing and what made me where I am today. And there's a lot of really fantastically competent chiropractors right here in our area. I don't know all the names of them, but there's my brother and sister, Dr. Kelly and Caroline, Dr. Todd and Caroline Rissacher. They practice in Jensen Beach at a Better Life Chiropractic Center. My brother-in-law, Dr. William Widener, he's a superstar right over there on East Ocean Boulevard. I can think of Dr. Kleinwax. I can think of Dr. Christopher Collins, who's an upper cervical specific chiropractor. There's Dr. Lisa Grossum, who's a fantastic person right on Colorado Avenue there. I don't want to leave anybody out. I know so many people. There's Dr. Jerry True, who was voted the Chiropractor of the Year by the Florida Chiropractic Association this year on his work with lasers and his work with helping people as an alternative to medications and stuff. So it's pretty amazing what's going on. Now, has anybody been watching the news? No, really? Well, I have. And I am appalled at what I see happening. I don't mean a little bit appalled. I mean, holy cow. If this isn't the medical establishment and the pharmaceutical industry and these huge conglomerates, with this global initiatives with the Gates Foundation and the Clinton Initiative, and that all are really pushing to a centralized medication for everybody. Medicine is going into personalized individual care per person. Okay, so we really need to explain this. Early, medicine is something that helps you when you need help, if you've ignored your systems. If you're at the river, let's say you're walking and you're at this raging river and you messed up. I mean, you made a mistake. You're on the wrong side of the river. You might need medicine to get across to the other side. So you need a raft to get across the river. It helps you. And when you get to the other side, you need to get out of the raft. You don't want to make it your houseboat. So for most of us, medications are really crisis intervention, symptomatic treatment for a mistake you made. You didn't take care of your health. You ignored the eating. You stopped exercising. You haven't been cleaning your body, internal and external sanitation. You know what to do. You see it all over the community right now. Everybody's exercising and running. They're scared to death that COVID's going to get on them. And they should be, because if you're unhealthy, you're at a high risk for it. I think everyone is starting to come to understand that. And pain and symptoms and discomfort is your friend to tell you that you are not behaving properly. Now there's 2 or 3 or 5% of people that have genetic malformations that it's not their fault. Okay. And then there's another 10% that happen from trauma, from things falling on you, from sticking on you, from, trauma that wasn't your fault. But the other 80% of illnesses and diseases are considered lifestyle, things that you could have prevented if you knew, if you did it, if you didn't have the help. And what I like to say about drugs is drugs all have the same effect. It doesn't matter if it's prescribed by the doctor or if it's bought at the marijuana store or if it's bought at the Walgreens over the counter. Drugs really work and they treat a specific discomfort, a pain, an ache, a breathing issue, lethargic, being tired. They help. That's why energy drinks are so popular, because they give you a little boost and your energy is low, Yet what happens is, because they're so darn effective, the mechanism which would make you make the change, if you sit around long enough with a pain in your leg, you're going to get up and find the reason why. And you're not going to take a drug for it. If you're having headaches all the time because you're working in an environment where you're breathing in toxins, such as in a city or in car exhaust, driving on the highway, and you take medications to stop that pain, you're not identifying what's really wrong. So drugs fool you into thinking you're okay. They give you a false sense that you're okay. Drugs don't cure anything. They treat your symptoms while you suffer comfortably. And this mechanism, this pain system, which motivates you to make a change, I promise you, if you didn't have the Advil and all the pain pills to take, you'd find out why it is you're hurting yourself. Because the pain will motivate you to do that. But because those darn drugs work so well for each and every ache and pain, you say, I'm not worried about it. And let me give you an example. So, you're overweight, you've been gaining weight, and you suffer an injury. You suffer a fall to your knee. Maybe your knee gets a little twisted. You go to stand up funny and it clicks, it makes a little pain and it's sore. And, it hurts all the time. It starts to hurt. So what happens is you take pain pills, Advil or Tylenol, because it gets rid of the ache at night. Now you have to go shopping. So what you find is, if I take these pain pills before I go shopping, I can walk longer and get the groceries I need. So you buy the $3 worth of Advil and you start taking those. And what happens is, in the very beginning, it works, but then you need to take more Advil because it's getting worse. So every time you go shopping, now you're taking more pain pills. Now you buy a knee brace, and you're not really looking at why it happened, which is losing weight, strengthening the leg muscles. Maybe your hamstrings are too tight. There's a lot of reasons why the knee hurts. And after 10 or 15 years of taking these medications, your knee becomes arthritic, and you go to the doctor and he says, my God, your knee is bone on bone. And you're like, well, how could that have happened, doc? You heard it 20 years ago. You had all these symptoms to tell you that you should have looked at your health, your wellness, your weight, strengthening your body. Yet you took the pills the whole time, and now we got to replace it. Had another patient in New York. She came to the chiropractor all the time for headaches, to me. And you know what? An adjustment can work for headaches really, really well. I think a lot of people know that. And so, I'm adjusting her, and it's not really going away. It's something, it's almost like she was using the chiropractic adjustment for the relief because she didn't want to take the pills. And I agree with that. So a lot of people go to chiropractors just for that relief instead of taking medication. And what happened was, it was working, and I'm a chiropractor. So what happened is, she had crashed her car. Now, she was going to the city all the time, leaving from Long Island and driving into Manhattan every single day. And what happened is, she had crashed her car, and they took her car away, and she had to take the train into the city for the 2 to 3 weeks while they were working on her car. And you know what happened in those 3 weeks? Her headaches went away. Now, it was nothing to do with what I was doing. She just came in, and so when she got her car back and she drove into the city, she said she had this realization where she smelled the car exhaust on the expressway. And that day, she had a really bad headache, and she thought it was from stress. She thought it was from work. And when she came in and told me, I said, maybe you're sensitive to the car exhaust. And I said, why don't you try taking the train from then on? And that's what she did. And her headaches went away because it was coming from the drive. You don't know. And if you keep taking the pills, you don't know where it's coming from. So that's my piece on drugs and symptoms. So one of the issues I really think is really important here today is this COVID-19, this virus. And I'm going to tell you that viruses are everywhere. They're never going to get away from viruses. Most viruses are symbiotic. They help us. Most of the viral load in our world, on our planet, it is like a million times more than any other, more than bacteria, more than tissue cells. Viral particles are one of the largest particles that we have to deal with all the time. And one of the real purposes of the viruses are they have a way of getting into bacteria and keeping bacteria from overpopulating. That's one of the bases of viruses. Most viruses are existing in the marine environment, in the oceans. And they say that viruses fall down from the sky. They did a study on viruses and how many there was in the atmosphere. And they put a collection dish at about 8,000 feet where it collected the air that blew through it. And when they took the samples of the air that blew through it, there was so many viruses in that air that it was 10 to the 23rd power. That means if you took every virus that was falling down and put it end to end, it would be 10 million light years long. That's how long the line would be. In other words, it's falling on us all the time. And these viruses are for the most part, beneficial. They help the marine plant life, they help plant life, and they also help animal life. Now, what's happens is there's certain viruses that occur in animals that will make the transition from animal to human. Now, we have lots of viruses in us too, which are symbiotic, which would make an animal sick, actually. So when these viruses move over into something else, they mutate, and we, not being exposed to this new variety, develop an immune response. So, the poultry industry and the animal industry, where they were studying these coronaviruses, they have a real problem with these viruses affecting the birds, the food source. So some of the studies on these viruses were to determine vaccinations to help in the poultry industry. And in those labs where they test and they do this is why they're there. They're not there trying to develop bioweapons to try to hurt all the humans or trying to figure human disease. They're there, many of them are there to help with these industries where the viruses are affecting the chickens and the pork and all these other animals. And somehow, in the testing and trying to figure out what they're sensitive to, how they can kill them, they can jump into a person. And it can also be from eating those animals, which haven't been cooked properly. They haven't, the virus, you need to cook things. If you're eating things raw, such as so many of these third world countries do, this is how this can transfer into humans. And a virus's job is to look for a host so it can live its life. And it can't replicate on its own. It replicates inside of a host, inside of a cell. Now, some viruses attack epithelial cells, lung cells. Some are blood-borne pathogens that deal more with red blood cells. And this coronavirus is a cold. The corona is the common cold, which we have developed immunities for because it's been around for a long time. So when somebody sneezes on you with a cold, you don't run to the hospital and think you're going to die. What's happened with this coronavirus is it is a novel, meaning new. And we don't really know how serious it is. So hence we have all of these protective measures, and there's a lot of them. And what's happening is in the last, I remember when you could see this happening. Now, this is not new. As a chiropractor, we've been watching these kinds of things happening. They call them epidemics. An epidemic is a very localized problem. A pandemic is worldwide. That's what that means. And so, the flu vaccine, the flu virus has been around for a long time, the influenza strain. They figured that it can respond to some vaccinations, but every year it changes. So the strain has to be changed. The vaccination is changed. That's how they deal with the flu. They look at, and I learned this 30 years ago because I didn't understand, my dad said, don't get the flu vaccine. I was like, why? I said, because you're healthy, you're young, you're not at risk for it. And then I find out that with some people, it doesn't confer any immunity. So I'm like, if they got the stuff right, why isn't it helping everybody? And that's because every year it's a different strain. It's a little bit different. And they call it the Hong Kong flu 129. I don't know the exact number. Hong Kong 234. They have these numbers. And here's what they do. They determine the most common prevalent strain in Asia, which is why they call it the Hong Kong flu. And then they attenuate the vaccine. They make these vaccines in large amounts, and then they bring them to the Western world, assuming that virus is going to move to the human population in the West in the summertime. I mean, in our wintertime. So the winter flu, influenza strain in Asia in the winter becomes our vaccination for our winter, which assuming it's going to travel over here. Sounds a little bit like this coronavirus, doesn't it? The same thing. And yet we don't lock everything down. We haven't closed all the stores. We haven't, emptied out the hospitals. This is where my little radar just beams with, oh my God, there's something really more going on here. And I'm not going to try to explain that. I'm not about conspiracy theories or anything like that. But I am a little suspect that they're trying to keep you from realizing that your body's ability to heal is the most important factor here that we're dealing with. You cannot rely on the medical professionals who have very limited knowledge, really, compared to what created us, to be able to defend you, right? It really, when you look down at it, it's going to be your own body's internal defenses that are going to protect you. Your body's ability to confront because it's not just going to be viruses, there's bacterial infections. There's worms, there's parasites that can affect you. And there's lots of different viruses. Remember, there's more viruses on the planet than any other structure. So with this intro, I am going to tell you that you've got to work on your health. Please, I plead with you that you got to look at what you're putting in your body. You got to look at how often are you exercising. You have to realize that the fluid that you're drinking, what you're taking into your body for nourishment to replenish your electrolytes and your fluids is water and not some concocted sugary drink that you buy because you like the way it tastes. We should be walking more than driving more, but we're not. We should have a garden. I'm making a garden at my house. Heck, I'm home. I'm socially isolating. No, I'm not. I'm staying home a lot because I'm waiting for this to pass over, but I'm not isolating at all because, I know my friends, you know what I mean? I'm not going, I'm doing what you got to do, but I made a big garden. I bought these, I found a nursery in town that has a bunch of old buckets that they don't need. There's hundreds of them, and I have them. If you need some, so let me know. And I set up I set up 16 of them on cinder blocks, and I went over to the mulch store, and for $100, I bought 2 big scoops of potting soil that they put in the back of my truck, and then I filled up all of these containers. And I'm growing a garden, and I got the right exposure, and I made a sun thing, and I feel good about it. It's exciting. It's got me back to nature. We need dirt. You got to get dirty, kids. You don't want to protect your kid from the dirt because when they're young, this is when they develop their immune system, is when you're young, not when you're older. It's when you're younger. And that's when you have all the faculties. That's why kids get sick all the time. Children and in schools, they get runny noses, they get colds, they get little fevers. When you're a kid, it's not a problem. I'm not talking about infants here. I mean, when you're 4 and 5 and 6 years old. And so that's important. And we try to keep them too clean sometimes because we don't want them to be dirty. Yet they're finding that people that live in more squalor actually have more of an immune system than people that live in the higher, the more elite living. So your immune system is developed through exposure, through encountering antigens in the form of poisons in the environment, pollen, dust, mites, and these antigens develop an inflammatory response, which you call a runny nose, the sniffles, an allergy, you start sneezing. And then what happens is the body's internal immune system, the T cells and the B cells, identify it, they make antibodies, and now you have a memory of that antigen. So the next time you can prevent it. So here's an interesting thing. If you're from up north and you live in the Adirondack Mountains, and you're not traveling much, and your main of your antigen since you were a kid came from the deciduous forests, from pines and must and the mold, you know what it smells like to be up north. I'm from New York. Now, you come down to Florida and you have never experienced the saw palmettos when they bloom, and all those little palmetto berries and the acorn drop that we have here, and the antigens are different than you had up north. So your body is going to have a reaction as if it was the first time you ever had it hit your body. And then you're going to get the runny nose, you're going to get the sniffles, you're going to cough a little bit, you might have a little temperature. The next year, you're protected from the antigens and the allergens within that area. Now, some of you are saying, wait a minute, I go back and forth, but I have to take medication for allergies. My system doesn't seem to. No, what's happening is your body has been sickened by other issues, whether it's food, not exercising. In other words, there are comorbidities that lead to having these kind of responses. You need to do it when you're younger. It's harder when you're older because your body just, your blood supply is impaired. You have too much body fat. You're not able to exercise as much. And this can lead to chronic inflammation. And when you have chronic inflammation, you're just not a very healthy person. So one of the biggest factors, and I'm going to read this. This is from the Daily Mail, which is a newspaper from the UK. And this doctor says, obesity is a major risk factor for coronavirus victims, says France's chief epidemiologist. And he says he has a special fear for America. He is particularly concerned about the U.S., where 42% of our population is obese. Now, what does that mean? Studies have shown that chronic health conditions such as obesity, diabetes, and high blood pressure can increase the risk of infection and death. Obese people who become infected with the flu are not only at a greater risk of severe complications, but they remain contagious longer. You're a carrier if you're overweight and you get infected by this thing. You remain contagious longer. In the U.S., there are more than 422,000 confirmed cases. So who doesn't know that? Is this news that the first time you've ever heard this? Did you know that half of the U.S. adults, and this is from September 8th of last year, half of the U.S. adults have diabetes or prediabetes directly related to weight gain. The study of government health surveys echoes previous research and shows numbers increased between 1988 and 2012. Overall, 12 to 14% of the adults had diagnosed diabetes in 2012, most of it type 2. And this is the kind linked with obesity inactivity. Almost 40% have prediabetes, meaning they have elevated blood sugar levels that could lead to full-fledged diabetes. Whites have lower diabetes rates than Hispanics, Blacks, and Asian Americans. white people, and that's not because they're black. It's not the color of the balloon. It's what's going on inside. It's the, it's the, a lot of them are in poverty. Some of them are, not all of them, but it's their habits. It's the type of foods they eat. It's the foods they bring with them from their cultures. Hispanics have a lot of rice and beans. They don't eat a lot of vegetables. They don't have big salads. Their meats are usually, very fatty, and and so on. So the other thing, which is quite shocking, is so now we bump it up to today, and people that are adults. So take 10 of your friends, put you in a room, 10 people, 8 of you will be overweight, and that means between 25 and 30% body fat. 8 people out of 10 are considered overweight. Now, out of that 8, half of them, 3 out of 4, are considered obese. And that means obesity, meaning 30 to 35% body fat. Now, we know that body fat at over 25 to 30% is a major risk factor for heart disease, diabetes, stroke, cardiovascular disease, cancer, chronic arthritis, depression. This is not news, people. This is old information that we seem to just we throw to the side as we walk out of these stores with all this junk food, and we refuse to exercise. Now, I like to say the chickens are coming home to roost, because the new statistic is saying that if you're overweight 25, 30%, and you're obese, and that's 8 out of 10, you are at a high risk for dying from COVID. It's not about vaccinations, people. It's about protecting yourself where you are and being healthier. So I'm not going to beat this horse too much, because this is a story of my life. I tell people all the time. And I also would like to say that I see a lot of people trying to make changes. I see them walking more and exercising more. But what's really sad? And you all know this. When I go to the grocery stores around town, to the Walmart or the Costco, do you know the fruits and vegetables are still full of product? Now, there's a few things that aren't there. The cilantro's gone, because we have a big Latin community that seems to love cilantro. But you go to the processed foods, the breads, the meat, the canned stuff. It's most of they're constantly replenishing it. But the vegetables and fruits, nobody's taking it. Now you say, well, they're stocking up. You can't store fruits and vegetables. Well, that's true. But they show up every day for the cigarettes and their alcohol. They didn't get rid of that. No, not everybody's doing that. That's not a fair comparison. But my point is people they don't like vegetables. They would rather eat, they've been trained. They've been adapted to this food industry, this Goliath industry that's undead, devitalized food. So my take on food and eating food, it should be live, healthy food. And you don't have to be a rocket scientist or become a doctor to know this. It's really vegetables in a natural state, cleaned, washed, free of toxins, organic if possible. And if you can't get it organic, you can get frozen vegetables in the bags. They've incredibly gone very well with freezing vegetables. Canned vegetables would be a lesser ability, because they've lost a lot of their vitality. And what happens when you eat fresh food is you get the sun's energy, which is tied up in the food, and they're called a starch. So the plant gets hit with the sun, and then it takes the sun's energy, which is radiant energy, radiating, and it turns it into chemical energy in the form of bonds in the starch. We eat the plant. And if it's a natural plant, which occurred without being putrefied and soaked in cheese sauce and canned and smashed and grinded and colored, if it's a natural base, you get a lot of energy from it. A lot of energy. Because you're transferring that radiant energy from chemical energy into your body. And that's what powers your systems. The nutrients, the carbons, the hydrogen, the substrates, there's no energy in that. That's what your body uses this energy from live food. And along with live food, you get all the minerals and the phytonutrients and the bioflavonoids, everything that you read about that our body needs to function. We were created perfectly. Our creator, whether you believe in natural selection or divine creation, we were created perfectly. And we came from the ground. Somehow, our plants, what we eat, and the animals that we choose to eat, if some of you like to do that, these are really taking the earth's nutrients and putting them into your body so you can build your body strongly. So when you make choices with food, let me give you an example of something which is devitalized. It doesn't have any life in it. If you take corn, which is very good on the cob, not so good when it's been processed and broken down and pulverized, it turns into a sugar carbohydrate, which is high sugar. That's why corn syrup is so bad. But with the way they make Doritos, which is probably one of the most popular snack foods ever invented, is, they take some, I'll give you an example. This is a little extreme, but you'll get my point. If I gave you a cardboard box and told you to shred it and cut it into little triangles, the shape of a Dorito, and then I had you bake it in the oven so it got a little crispy, but at the same time, I'm going to put fat on it. I'm going to soak it with salt and sugar and then some spices. And then I'm going to bake it, put it in a bag, and call it nacho cheese Doritos. There's very little live food within that product. Bread, whole wheat breads and bagels and pastas, these are wheat products. Now, wheat in its natural form has a husk. It has fiber in it when you have wheat. But what we've done is people don't like the fact that wheat is chewy, and they strip the husk. They strip the fiber from wheat, and it's called enriched white flour. Or it can be whole wheat flour, but rarely do they strip out so much of the good stuff from it that now you're getting something which is like sugar. It's a carbohydrate. And there's very little energy in those molecules, really, other than making fat. And the same thing goes with anything which has been concocted and produced, and it just goes on and on. And here's a really part about when you eat foods that aren't healthy. Your body has to get rid of the toxin. So every time you drink alcohol in excess, and that, it depends on the person, your body has to get rid of the toxin from it. When you smoke cigarettes, even occasionally, or suck on a cigar, even though you're not breathing it in, and you got those poisons in your body, or you're eating foods that are filled with preservatives and chemicals, your liver and your kidneys and your energy has to be used to get rid of those toxins. Now, suppose you were to be hit with an infection from the COVID or any infection. It doesn't have to be this virus. It could be stepped on something and cut your foot. All of your energy needs to go to healing that wound. Yet 30% of your energy is being utilized to get rid of the toxic food that you ate the day before, which is why our stomachs get so big. They get distended. They're weak. The musculature is weak. It's not like, your muscle, your stomach's a big muscle that travels through. And when you don't eat, you eat too much, it gets distended and it gets weak. And then we develop toxins that collect in our body. And then the energy that you're given every day for life, half of it goes to getting rid of the toxins, having bowel movements, urinating all the time, right? So if you can cut your diet 30% less food, that's a win because you'll have more energy for healing. And if you can eat food which is very healthy and more nutritious for you, then you're going to get the energy along with what the body already has. So now if you get a cut in your foot or you get exposed to some kid who coughs on you and your body needs to rely on its immune system, there's energy reserves to heal to help you to get through that. This is what they're not talking about. They're just telling you to stay home, don't go out with your mask, keep your gloved hands, stay away, and wait for the vaccination. And I'm telling you, that is a recipe for death. And yeah, there I said it. Okay, I said it. So what do? I got it here. I got it here somewhere. All right, here it is. Here's my to-do list. Now I want you to know, my listeners, you know where I'm at. Send me an email. I will send you this list. Here's my to-do list. Drink at least close to a gallon of purified water each day. Now, not everybody can do a gallon, but try to drink some water. You must exercise or move your body every day. Walk, jog, swim, practice yoga, do push-ups, leg lifts, whole body vibration. That's what we use at the office. We have these vibration plates. I got a bunch of them. You're welcome to come in and try it. It's something that you can do at home. I can bring him to your house. I have my nephew. He's not doing nothing. You can go online, Dr. Tread's Body Vibe, or go send me an email. I'll send you a link, and you can purchase one. They're $980, and my nephew will drop it off for you. All right? He's a good kid. You got to move your body every day. It's an immutable law. It cannot be ignored. If you ignore the law of movement, nature will slowly or quickly eliminate you. Number 3, eat live food. Lots of fresh veggies, low sugar fruit. At least 75% of your dietary intake should be plant-based. Number 4, eat high quality protein only. Stay away from processed meats. No cold cuts, no deli cuts, no pork sausages. These create inflammation in your body. You want high quality protein with the fat trimmed off. Fish, wonderful choice. Take extra supplements besides what you're already taking. Dr. Tread believes in supplements. I take them every day. Vitamin C, vitamin D, vitamin A, zinc, B complex, multi-mineral supplements. You got to take supplements. You're not getting it from your food anymore. If you're eating dead, impoverished food that's been processed, fried, soaked, big pizzas, big pasta plates, you're not getting any nutrients in those foods. You have to supplement. You got to add them to your diet. Okay, if you're overweight, get the weight off. You can't be overweight, people. The main cause of being overweight fat is mostly due to overnutrition and mostly sedentary lifestyle. That's why it's not considered disease. It's your fault. Now, with that said, it's a lot harder to lose weight than you realize. If it were easy, everybody would be doing it. That's why you need a program. You need someone to help you. You know what I do for a living? I'm a weight loss professional. I use lasers. I use whole body vibration. I go over nutritional. I have goals. We have standards. Now we're also to the point now where we can do this online. We have these home machines now that you can purchase. They're lasers, and we can sell that, and we can have you hooked up at home. We're not quite ready to completely open it up to the whole world, but we're getting there. So I really appreciate you tuning in. You know who I am, Dr. Tread Rissacher, Slim Body Laser Spa. Shoot us an email. Do the contact page. We'd love to help you out. Say goodbye.